the next question that I want to deal with comes from Megan. And she asked, how can we keep our kids from absorbing our anxiety through this crisis and still maintain a normal kind of environment for them as well as for ourselves? And that's a really good question, Megan. And I want to broaden that even a little bit more to just talk about anxiety in general, because in my definition of anxiety is a fear response, an arousal fear response that is disproportionate to the risk. So look, if I throw a rattlesnake up on the table and you have a fear response, that's not anxiety, that's fear. It's proportionate. There is a clear and present danger, so naturally you're going to have a fear response. What happens is if I put a rubber snake up on the table and you run through a plate glass window to get away from it, that's disproportionate. And what I'm concerned about here is so much of what I'm seeing in terms of emotional response to this COVID-19 coronavirus pandemic that we're facing is disproportionate to the risk involved. 85% of the people that contract this infection are going to have mild to moderate symptoms and then get over it and go back to their lives. Dr. Sophy, talk about this for a minute in terms of the anxiety. What do people need to do to put this into perspective?
Well, I think the first thing they need to really understand is the anxiety is coming because they feel there's something they can't control. And they're right, they can't control this, but they can control what's going on in their own home. So limit your exposure to hearing all this news and all of that kind of stuff that stirs people up. Make sure you're doing the self-awareness that you need to do. Otherwise, you are going to have it flood and then go right on down to your children. And being able to really be calm, have a structure, and be self-aware. That's the key, because we're never going to control this, but you can control your environment around you.
Putting it into perspective is not trivializing it, right? I mean, to put this into perspective where you tell your kids, look, be calm. I want to reassure you here. Let's talk about what the facts are and not the sensationalism. That's not trivializing it. It's just being realistic.
I mean, if someone is going to be positive for COVID and have it, they're not going to have a cough and then the next hour be on a ventilator. There's a process to this disease. So, letting your children and yourself be aware that if the minute you have a feeling or a symptom, you'll jump on it, that gives you the feeling that you have some control.
Right. And we do have control. Coach Mike, from a behavioral standpoint, we have control over this in terms of our conduct. We can maintain everything from hand washing to social distancing to respecting the need to wipe down surfaces. We can behave our way to health on this. We're not helpless, correct?
We're not helpless. And it's also such an opportunity for someone to teach their child how to get through a difficult time, how to be resilient, how to push through. And part of that behavior is not engaging in conversations that create a lot of anxiety, from being on the telephone and talking to friends to consuming too much news. It's like junk food. After a while, you just start to feel it. And I look at this as just a great opportunity for a parent to teach their kid, this is how we get through a crisis. This is how we become resilient. And it takes effort.
Well, it really does. And, I always hear people say, speak to your children about things in age-appropriate manners, but they never define what that means. So let me define that, at least from my point of view. If you want to talk to your children in an age-appropriate manner, here's the way to determine what that is. Ask them first what they know and what they want to know. Don't go in assuming that they understand A, B, and C, because they may not. Ask them, tell me what you understand about what's going on right now. Do you know what pandemic means? Do you know what COVID-19 is? Do you understand what's happening in the hospital? Tell me what you understand. And they will tell you their level of comprehension, and you meet them where they are.